thank you very much. It's for me a nice opportunity to change continent and change the topic. I'm a physicist, you know, and I'm going to try to give you some idea how we physicists are involved in trying to develop new technologies and help the translation to make sure it gets to the market as soon as possible, okay? So I am in University of São Paulo, in fact, and today in absence to do something at Texas A&M related to melanoma, which is not exactly what I'm going to talk it, but I'm going to give you a few transparency on that. I have a team in Brazil, which is huge. Everything in Brazil is huge. And a team in Texas, a little more modest. And everything I'm going to tell you is in the homepage that you can find there. Okay, so we are working with some techniques to taking a few challenges. And of course, microbiological control, especially bacteria that are resistant to antibiotics, is one of the main things I'm doing, using photoreaction to break down the resistance. Cancer, of course, as this audience, we don't need to elaborate the importance. And chronic diseases, you know, diseases that are related with pain, that there is no cure, but can we do something on the physical part to make that go? You know, we are always driven by the fact that the cost of cancer treatment is increasing. And, you know, I don't think we are facing a very nice time. We never treat cancer so well, but the treatment was never so little available for people in the world. We are treating less people because their economic reality forbidden to apply in many sites of the world, including Latin America. And things like skin cancer that can be easily solved, but the number is so big. Brazil has close to 300,000 new cases of skin cancer, and they all go for surgery. And that they just overloaded the system. And we could treat that in an ambulatory type of things, but no, they go to the hospital and they are costly because, you know, they involve a lot of infrastructure. So small lesions that can be easily treated goes to severe complications sometimes, and there are many. I have a paper only about how skin cancer can kill. And what principles we use? Photodynamic action, I think you all know about what is photodynamic. You know, it's a photoreaction, and that's why molecular physicists are involved, because we try to see the things like molecular physics inside cells and make sure that we can get there all the ingredients for having photoreaction that produce severe photooxidation and destroy the cell. So this is one of the principles we use. And now we add the sonochemistry that you may not be so aware of. Sonochemistry and shockwave chemistry. As you know, ultrasound can produce gigantic pressure waves that force reactions that will not take place otherwise. Therefore, you can produce cavitation, sonoporation. You may destroy, you may change the way cells goes, or even then damage the nucleus of the cells and stop them to reproduce and things like this. So those are the techniques I combine in most of my applications. And, but I wanted, because antibiotics is one of the challenge, resistance. Recently, we have demonstrated breakdown of the resistance, and we are going for now the treatment. We demonstrate we can treat pneumonia resistant to antibiotic, because we can go inside the bacteria and destroy the mechanism that they use it to be resistant. Therefore, they became susceptible to antibiotic again. And this is not cancer, but as much important as, or even more than cancer. You know, we all gonna die of infection if we don't do something about antibiotic resistance. But this is not the topic. The topic is cancer, and we've been having many initiatives to use development of technology, procedure, and instrumentation to treat many different types. Those are clinical trials in different parts and different types of cancer. There is one that's intestine that we just saw a paper about that now. And this is an initiative, a small clinical pilot in young kids with intestine cancer to avoid cutting down when they are young kids still. And it seems to be going well. Esophagus also going well, but it's still not in the level that we can say that this should be a first choice, and many others. But the skin cancer, I'm going to start speaking about the non-melanoma. As I said, it is a big threat because the number is big, and if we can do simple and non-expensive way of treating, we can contribute a lot for this. And this is what we have done. We put together companies, we put together institutions and medical doctors to work together. And finally, we were able to reach 95%. You know, this clinical trial had, I think, 7,000 lesions treated in 100 centers in Brazil. It's a multi-center with the device that was developed that you can see on the top. And today we have even started the treatment in the hospital, but send the patient home with a device that you stick to the patient's body. And we've been able to reach 95% elimination of the lesions. And today, this is not enough because people claim that they have to wait too long for the medication to get in the cell because we have to make molecules to get in the interior of the cells to apply the light and promote the photoreaction that will generate the free radicals that will destroy the cell. Then we developed for skin cancer microneedles, soluble microneedles that you can stick to the tumor and then you save a lot of time. So in half an hour, the patient is prepared for getting the treatment. That takes another half an hour. So in 1 hour, the patient, if the doctor does following the rules, we should eliminate 95% of the lesions in a very low cost. And now, with the microneedle, we hope to get to 97% and depth of penetration much higher than the lesion. So we're going to have a good margin for decreasing the recurrence. We are doing in Brazil. It's being approved for the social medicine in Brazil by SUS, this technology, and it's being financed by the government. And now we are in a few different countries in Latin America implementing the same technology. Okay, well, of course, we all publish a lot of papers. We love to publish papers in the academy and proving to be efficient. And this process that we developed using the photodynamic reaction that's well known is fluorescence guided. So it means the doctor knows in real time what he's killing. And he only stops when he reaches the margin that he thinks is safe to stop. And that's why we're getting recurrence in long term. 10 years we are following patients already. That's compatible to surgery. And that's where motivated the social medicine in Brazil to adopt. And the results are very good. So we have a comparison of different methodologies, and we are kind of in the safety part in doing that. And more recently, we did a group of patients with diabetes. You know, diabetes, it's something else, but skin cancer means surgery and means maybe problems with diabetic people. And we did a group of people. Normally, you have 10 to 20% intercurrence or complications on some types of skin cancer for diabetic people. But with this procedure, you have 0, which is very incredible. You know, you cannot cure the cancer and leave a wound that will not recover and problems that will come later on. Okay, so how is the model that we have done? Put together a national bank that's available to financing the things, companies and institutions that together can develop the instrumentation and the procedure to go. And have done that. We even simplify. Before we start with 2 sections separated by 7 days, now we do a single visit. In a single visit, you are able to diagnose and do the treatment. Don't send the patient home back. And this is improving the life of the people because they normally have to travel a lot to get the diagnosis and then to get the surgery done. This was approved by the social medicine in Brazil. The plan is now to start 500 centers in the country to treat the lesions and to be able to implement and test the model for the skin cancer, no melanoma. Okay, and we are together with the main institutions that are related to cancer, skin cancer. INCA is our national, is the reference institute in Brazil, but we have also the Brazilian Societies for Dermatology and Oncology together, following up and everything. And companies, we could not have the photo medications or the sono medications, and then we helped to develop special companies that now are even exporting medication to Latin America and North America because of the price. Everything is being approved by our local authorities, and we are putting together a platform on the internet to train people for this procedure. So this is so easy that if the guy has some good, like school on medicine or in nursery, the nursery is very important in this whole procedure. They can apply the procedure very well. Equivalent to cervical cancer. Cervical cancer, already in a talk today, they show the importance, especially in Brazil. We are vaccinating everybody, but we have 30% of ladies contaminated with HIV, HPV, and they are potential for developing the cervical cancer. So we did exactly the same we did for skin cancer, but now for cervical lesions. And, but now it's evolving, and even Americans are getting involved, and I'm going to show you the involvement with the Global Health Program of NIH. And you see the device on your left. We treat not only the cervical lesions of a high degree, but we also treat the HIV lesions that are outside to prevent transmission and to prevent the evolution. And the program is very nice, especially because we can see subclinical lesions. So we can start to treat ladies that the lesions did not appear yet. And they can get that with fluorescence and the same procedure. So the procedure is in an ambulatory type. You see the device, and there is a device, and you have to put a cream inside, you know, on the column, in the cervix. And normally the ladies apply with an applicator on the night before going to the procedure. So when she gets there, she's ready to go to the procedure. And again, papers, I like to show papers anyway. So we've been convincing the doctors to treat lesions in the different stages. So CIN is cervical intraepithelial neoplasia, as you know. So we normally CIN1, they don't do anything, but we start to treat, and we got a good gain. That lesions did not evolve and regress. And then, of course, CIN2 and 3 is already considered carcinoma in situ. So we got a tremendous result with, again, you know, 87% of the patients treated did not show lesion 2 years after the treatment. So that prevents surgery and everything else. Well, what's interesting about this device is the same cream enhancing neoplasia, so you can detect the lesions of HPV subclinical, as you can see in the plot there, by optical fluorescence, so you can detect that. We got a few prizes in South America, you know, and one in North America, Sanofi prize for the Humans Health Program. And today we improving more, 87% is not, you know, we can do much better. And now we are doing an ultrasound scalp to remove the lesion, and then we treat the basis. That should increase it to 92, 95%, the eliminations of the cervical lesions. And we are facing a problem in Brazil, and I hear everywhere in the world, which is oral condyloma. And also we develop a kind of varnish that we paint the lesion, and then we do the photodynamic and sonodynamic. And we've been eliminated in young people, the HPV lesions, oral lesions. We are involved in the Global Health Program together with M.D. Anderson from Texas. And this is pictures in Mozambique. And we are also in Angola. M.D. Anderson is doing the diagnostic, and we are trying to implement the treatment of HPV lesions in Africa, which is a situation much worse than Brazil and, of course, in many other places, and I hope this will be well succeed. On the melanoma part, melanoma, you know, is surgery, have very little to do, and we've been able to make a very nice instrumentation to kill the melanoma around it. And then we isolate, and then melanoma dies. And we didn't do in people yet, but we got the permission just recently to do. And, but we did in pigs. We have a pig model, melanoma in pigs, which is not so far from humans. And even massive melanoma we've been able to treat. And this is a good result. And with negative pressure and microneedles, we've been able to stop the growing of melanoma in mice model. And this is also an important thing, because if you stop the growing of the melanoma, this is already a big chance for doing surgery and avoiding metastasis and things like this. Well, about cost. The equipment in both cases, there are different equipments, of course. One is for treating the cervix, the other is skin. They are very different, but they cost about $3,000. And we already test, because we treat so many, you know, getting close to 10,000 lesions now. And we can do 1,000 applications without necessity of any maintenance. So you can say $3 of equipment per lesion that's treated. The cream per application costs about $160. Infrastructure, nothing, because the equipment is the infrastructure. Time to prepare the patient, 30 minutes. Time of incubation of the medication, a cream or even systemic drug, that's depend on the type of cancer you're going to treat, is variable. But now with the new technology we implement, we're going to be able to do the preparation of the lesion in another 30 minutes. And time and cost of the professional, well, I don't know exactly. But what I know is surgery in Brazil can cost between $2,000 and $12,000, depending where you go and what's your lesion. So that's a good gain in terms of cost benefit. Well, there are many, many people involved, many doctors that get involved with the plan, and because of the doctors is that the technology was legitimated and will be available for Brazilian people in this coming year of 2026, starting with 500 centers with the possibility to evolve to about, you know, they're speaking about 10,000, but I think we don't need 10,000 centers. We need about 5,000 well-established centers that will cover quite well the geography of Brazil and treat well the patients. Well, thank you very much.